Good afternoon, everyone. I'm so glad that you're here joining us for our FMPhA community call, something that we do monthly to get together and also discuss a book that is relevant to our profession. And we're going to go ahead and get started today. We open every call with a little bit of deep breathing or some other meditative exercise. And today's exercise was inspired by the book that we are discussing today, which is Lost Connections by Johann Hari. And in the book, he discusses the benefits of loving kindness meditation. So today, if you would please join me in doing a little loving kindness meditation together. So take just a moment to be nice and comfortable in your seat. Take a few deep centering breaths. This meditation uses words, images, and feelings to evoke a loving kindness and friendliness towards oneself and others. With each reciting of the phrases, we are expressing an intention, planting the seeds of loving wishes over and over in our heart. With a loving heart as the background, all that we attempt and all that we encounter will open and flow more easily. Let your body rest and be relaxed. Let your heart be soft and let go of any plans or preoccupations. And begin with yourself. Breathe gently and recite inwardly the following traditional phrases directed to your own well-being. You begin with yourself because without loving yourself, it is almost impossible to love others. May I be filled with loving kindness. May I be safe from inner and outer dangers. May I be well in body and mind. May I be at ease and happy. As we repeat these phrases, picture yourself as you are now. Hold that image in a heart of loving kindness. If you find it easier, picture yourself as a young and beloved child. And you can adjust these words and images in any way that you wish to create the exact phrases that best open your heart for kindness. May I be filled with loving kindness. May I be safe from inner and outer dangers. May I be well in body and mind. May I be at ease and happy. Practice this meditation for a number of weeks until the sense of loving kindness for yourself grows. And when you feel established with a stronger sense of loving kindness for yourself, you can expand your meditation to include others. This might sound like phrases, may you be filled with loving kindness. May you be safe from inner and outer dangers. May you be well in body and mind. May you be at ease and happy. Let the image and feelings you have for your benefactor support the meditation. Express gratitude to your benefactors, and it's a natural form of love. In fact, some people find loving kindness for themselves so hard, they begin their practice with a benefactor. The rule is loving kindness practice is to follow the way that most easily opens your heart. We'll take just another few deep breaths to repeat those phrases as you need, whether they're for yourself or for someone else. And then when you're ready, open your eyes, bringing your awareness back into the room. Thank you all for joining me in that opening meditation that came from The Art of Forgiveness, Loving Kindness, and Peace from Jack Kornfield. And for our announcements, FMPhA, our 10-week business boot camp, we have a new fall cohort that will be starting. Open enrollment is on September the 1st, and we will start that cohort on September the 20th. This is a really exciting opportunity for you to get some clinical education, but also some business basics. And we hope that you'll consider joining us. And if you have more questions about this bootcamp program, please reach out to us at info@fmpha.org, and we will try to answer all your questions. But the link that we have here on the screen has a lot of great information for you about that program. And there's many of our bootcamp students who are likely on this call, so please, in the comments, tell us where you're from, if you've done boot camp, if you're a current member, so we can all start to connect and network in the comments. Some upcoming events I want to share with you. We have our quarterly standard process webinar that's in partnership with Standard Process, and the speaker is fellow pharmacist John Morrow. He has prepared an amazing presentation on drug-induced nutrient depletion, and that's going to be a great educational opportunity. So be sure that you watch for the links to sign up for that. And if you're not already on our newsletter, that is where you would find that. And I want to share about the Mindshare Summit. This is a fantastic business building opportunity. Lauren and I had the opportunity to attend last year, and it was a wonderful time of networking, meeting like-minded professionals, but also getting a lot of great business building support. So I would encourage you, this is the last year they're going to have Mindshare Summit as a big conference type event, and it should be really fun. Lauren has a discount code to share with all of you. So if that's something that you're interested in, there is a link and a discount code. And past events, Lauren just got back from ASCP, that's the American Society of Consultant Pharmacists, where she presented answering other calls. An amazing presentation on being an age-friendly pharmacist and how that applies with a functional medicine lens. And that is available now in your member portal. So if you're not a member, please check out the website, find out how to join us as a member, and you can have access to that. And for those of you that are members or bootcamp members, that's available in your member portal to see if you are not able to attend that event live. And as a reminder, this is all of the books that we are going to be covering this year. This month, we are covering Lost Connections by Johann Hari, and next month, we'll be covering Viral Justice. I'm very excited about that one. And I'm going to turn off the slides so that we can all jump in and discuss the books together. And it's so good to see so many of you here. Thank you for spending your lunch hour with me. And Lauren is in the comments dropping links for us. So thank you very much, Lauren. We appreciate that. And I'm going to get over here so that I can see the chat and see what's going on. Yay, fellow Texans. So I'm curious, how many of you had the opportunity to read our book, Lost Connections? I was so excited by this book, and I can't wait to discuss it with you. It really hit home for me personally as I was reading it. I see Danielle says she started it but hasn't finished it. I would love for you to come off mute and tell us, what have you learned so far in the book? I'll give you, for the rest of you, that are just tuning in, Lost Connections is a book about uncovering the real causes of depression and the unexpected solutions. And he identifies multiple different ways that we are disconnected in our communities and in our purpose in life, and outlines some really surprising ways. I guess they're not surprising. I think they're very common sense, but in the cultural norm that we live in, they're not common sense. And it was a really great read. So Danielle, I would love to hear what stood out for you so far in your reading.
So far, I think it's interesting how he talks about the criteria of being diagnosed with depression, and how, like, for a period of time, it was like, yep, if you had a major, like, traumatic event, you kind of got like a grace period before they would diagnose you with depression. But then now that's gone again. And once just the diagnosis criteria, how they have changed so dramatically, and we're not taking into account like life, and the way that it happens. I think that was really interesting to me. And that's, I think I'm on like chapter 5, so I haven't got very far. I was trying so hard to get into it, but, and just like when he deep dives into the studies and talking about how, like what the criteria are that they use to decide that a drug is effective or not, which I think I've kind of seen in different realms, but it's interesting to get more perspective on it.
Yeah, I really enjoyed him unpacking the studies. I think we're familiar with a lot of it, but to hear him unpack it along with some of the social, I'm lacking the right word today, studying it in the social sense and the cultural studies that they've done, and just how we view cultural norms in comparison to what is the criteria for the drug to work. Thank you, Lauren. I'm at a loss for words today. Biopsychosocial spiritual. Yeah, the biopsychosocial model of health. I mean, we're learning how much our environment and emotional landscape influences our health. It's huge. So I'm going to list off for you guys the disconnections that he labels in the book. The first disconnection is meaningful work. The second one is disconnection from other people. The third one is disconnection from meaningful values. Fourth one is disconnection from childhood trauma. Fifth is disconnection from status and respect. The sixth one is disconnection from the natural world. 7 is disconnection from a hopeful or secure future. And causes 8 and 9. These are the real role of genes and brain changes. I thought it was very timely for me to be reading this, as I chose to leave my full-time job last month. And it highlighted for me that I was making this choice for my mental health. I don't have a diagnosis of depression. I have struggled with postpartum depression in the past, and anxiety postpartum. And I don't think that I identified myself as having depression, but as I read through this, I could see where I was headed if I didn't make changes. And I was very encouraged that I was headed in the right direction. I was making this change because being disconnected from meaningful work was part of some of the dissatisfaction I was having in life, even if I wasn't going to my doctor saying I'm depressed and I need support with that, or looking for other support. And it was very encouraging that it's okay to make changes, that we don't have to keep up with the status quo of consumerism, and how do we make our lives look different so that we can pursue meaningful work. There were so many gems for us as pharmacists and entrepreneurs. I wished that I had access to the hard copy. I bought this after I had finished the book, hoping that I could go back and remember all of the mic drops that I heard as I was listening to it, and didn't get a chance to. I think I'm going to have to start listening with the book in front of me to take notes, so I can come back and talk to you guys because I couldn't go back and find what I wanted, and it's in my brain. There was so much goodness packed into this book and an emphasis on community. This book reminded me a lot of The Community Cure by James Maskell, which is one of the books that we read last year. So if you guys haven't read that yet, I would encourage you. That's another one. It's really short. It's an easy read, and it was really good. Really enjoyed his book. And it talks about how do we have group health models that can help us move forward in delivering better patient care, especially when we're faced with a clinician shortage. How do we give better care at scale? And it's a big piece of what he talks about in the book. Since we're on the topic of mental health and depression, are there other resources that you've read that have been really impactful? I love it when you, as our members, give us suggestions for what to read, because that's how we came across this book. One of our members suggested it as we were talking about mental health last year, and we picked it to read this year, and it's so good. Thank you to whoever suggested it. Oh, thank you, Lauren. Lauren dropped in the comments a link to all of the books that we read last year. She's compiled them on an Amazon book list. Thank you for that, Lauren. We appreciate it. Oh, Lauren says there's a discount if you get the ebook and the audiobook. Good to know. I still like a tactile book if I'm gonna. Ebooks are good, but I do like the sensory experience of a physical book in my hand. I want to share with you a story from the book that really stood out for me. And there were discussions of trying to introduce antidepressant pills in Cambodia, but there wasn't a name for like an exact translation for this. And as they're trying to describe it to the people there, they say, we don't need that. We've already got it. And the people were confused. What do you mean? Antidepressants are new. They're the latest, greatest thing in medicine. How do you already have them? And they gave an example of a farmer who had had a catastrophic injury and he could no longer farm. The physical demands of that job were too much, and he was getting really depressed. And his community recognized that he was depressed because he no longer had meaningful work. So they bought him a cow and helped him become a dairy farmer, because that was a job that he could do sitting down, and it was taxing on his body in a different way, one that wasn't like the farming. And the depression lifted, and he was happy and healthy and thriving again after they helped him have a change of profession. So I love that they said, yes, we have an antidepressant. And for this person, it was a cow. And for someone else, it would be a different solution. And it's going to be very individualized based on what's triggering the depression. Lauren has a great comment here. Kelly Brogan, MD, her work is some of the most impactful. She's a psychiatrist who no longer prescribes medications and has documented cases of helping folks reverse mental health issues with lifestyle and nutrition. I love that. That really supports one of the big takeaways from this book, is that when we have what's being labeled as something pathologic and a mental illness, it's actually a normal human response to the circumstances of our life. And we need support in moving through that rather than a diagnosis and being told that we're broken in some way. That was my big takeaway from this book, is that there is so much more we should be doing for people before we reach for pharmaceutical fixes. And I don't want to negate when patients want the pharmaceutical fix as a way to support their body. And I always encourage my patients when they are wanting medication that it's absolutely okay, but this is going to give us a window of opportunity for you to make lifestyle changes, food changes. Maybe it's a job change. There's some change that needs to happen in your life, and whatever pharmaceutical intervention that we're giving you is there to help resolve the symptoms temporarily while we work on the root causes. Lauren says, this is the study on her Vital Mind Reset program. Pretty cool to see how an online business can be published as real clinical research. This is very much the vision I have for many of our pharmacists, creating their own clinically impactful programs while building a sustainable business for themselves. Yeah, I think there's a lot of value in the online communities and creating ways to connect that allow you to still be in the comfort of your own home. I think we need both the online businesses, but also the physical spaces where people can gather and get a hug if that's something that your nervous system wants. I know not all of us welcome some of those things, but if your nervous system wants a hug, let's get you in a room where you can get a hug. I think we need hybrid opportunities. I love that you say that, Lauren, that we're looking for these sustainable opportunities. And I think at scale, the digital platforms allow us to do that because we can work from anywhere and we're not geographically limited. I think that's really, really helpful. And there's days, and I have patients that they're like, I don't have the energy to go physically be in the room with someone, but I need community. And Zoom is where they can get that community when they don't physically have the energy to be around other people. So there's value in both the in-person and the Zoom or virtual. We have a comment from Gashiru. I hope I'm pronouncing that correctly. I think it is very key that knowing and acknowledging our true self identity is very much a factor in coping and thriving in society. Yes, there is a lot in our culture that says to ignore what's stirring in our soul, pick yourself up by your bootstraps and keep going. And that's not serving us very well. Anyone who's available to be on camera and chat, I would love to see your beautiful faces. I know some of you are working, and we respect HIPAA and patient privacy. For those of you that are meditators, tell us, what is your favorite meditative practice? That was one of the key things discussed in the book, was how meditation was producing the same effects as the psychedelic experiences. And they're unpacking the changes that are happening with the brain. And not all of us enjoy the same type of meditation. So I'd love to know, what meditative practices do you find the most beneficial?
We'll jump off of mute here and just share on that topic, since it's such a big passion of mine. When I first started down this whole path of like meditation. And this was way before I even ever imagined I would get into psychedelics whatsoever. It was around 2019 and like beginning of 2020 that I started exploring meditation. Like I kept hearing about it. There was another pharmacist that I followed on the internet who kept talking about meditation and how she was like really struggling at first, but was starting to get better at it and it was starting to become more enjoyable. And so I started with the Headspace app, which I think was like kind of just getting started back then and was really popular. And it was really helpful because it truly just was like the very beginning, right? Of like, okay, we're going to meditate for 5 minutes. We're going to guide you through it. The point of meditating is not to clear your mind. That is not the point. Everyone thinks that's the point, but it's not the point. The point is that you're going to have thoughts that come in and you're going to notice the thoughts rather than attaching to them and following them and actually getting wrapped up in them. You're going to realize, oh, I'm thinking about something, and then you're going to let the thought go. And you can imagine it like it's floating down a river and the thought is just floating away from you, or the thought is like a cloud and it's just floating away in the sky and you're just observing the thought floating away from you. And I was like, okay, I think I can do this. So that was like for me the start of it. And then there's also techniques where you can use your breath as like an anchor. So you can just remember to keep breathing and like consciously, meaning like you are actively choosing to breathe. I call it manual breathing because from a science standpoint, right? Like breathing is an autonomic function. We don't actually have to consciously think about it. But yet when we actually do choose to focus on our breath and take a deeper breath and control our breath, it focuses your mind and your energy on that process. And so it actually takes you from being caught up in your thoughts and bringing your focus back to your breath and your body. And so that was like another technique. And then the last technique I started working with was positive intelligence, which there's a whole book about that. And if you're in the Amazon store, there's links to all of these different techniques and books. But positive intelligence kind of builds on all of those things. And then it also includes something called PQ reps that essentially are body-based practices. So it's doing things to orient yourself in time and space. And this is something Joe Dispenza also gets into in some of his work. And so, the point is feel your feet on the ground. Feel your sit bones in the chair. You can touch your fingertips together and feel the ridges of your fingerprints. Like all of these sensations of touch can be very grounding as well. And then you can also do even open eye meditations where you are focusing on one particular object, or you could be looking around at different objects and noticing everything that is the color red in your room. Like all of these are different types of meditation techniques. And then the last thing I'll add is once I kind of started exploring all of these, again, this was like 2020, 2021, I started getting much more into Joe Dispenza in 2022. And I sort of went through my own like period of like clinical depression after my mom passed away in 2021. And that time frame, I was still using all of these tools. But it wasn't until 2022, whenever I started working with psychedelic therapy, that I then saw like just how important meditation is in order to be able to go deeper into some of the psychedelic work for sure, but even just a lot of therapy work and like mental health work. If you don't have that sort of baseline, to be able to separate yourself from your thoughts, that is the root of anxiety and depression. So the way I've had it described to me is that depression comes from essentially a longing or an attachment to the past, and anxiety comes from an attachment to the future. And once you can bring yourself back into the present moment, which for all of us, like I'm in Eastern time, it's 1:33 p.m. I'm sitting in my office on a Zoom call with all of you. And so it doesn't matter what's happened in the past. It doesn't matter what's going to happen in the future. The only moment that actually exists is happening right now, and we're safe. That's it. That's the point of meditation. So, long explanation, but it is life-changing. It is truly, truly life-changing. If you've never worked with meditation or practiced it, I am more than happy to help provide resources or tips or techniques, anything I can do to help with that. It's really important work to me.
Thank you for sharing that, Lauren. That was really helpful. I love that you covered thought-based practices and body-based practices because they're both really helpful, and it depends on what you have going on in your body as to which one might be more beneficial at a particular time. I am someone who lives very much in my head, and I learned that that's an unhealthy place to be. You create your own echo chamber, and that's something that's discussed in the book is how helping others, finding ways to take the focus off of yourself really lifts your mood, your spirits, but it also lifts up everyone else around you. So it's a win-win. And I live so much in my head. I'm an Enneagram type 5, for those of you that are familiar with that. And body-based practices were something that helped me get out of my head into my heart and then start to be able to share and create community with other people in the world. For type 5s, we are very unhealthy when we want to keep hoarding knowledge and not share it with the world. And it was through body-based practices that I was able to start sharing and showing up here with all of you, because those practices helped me get out of my head and not be stuck there. And so my favorite body-based practice is a flow yoga or nature walks. That's another really good one. Lauren is an Enneagram 3 with a wing 2. Does not surprise me at all. Very, very high achiever and a lot of caregiving qualities. I have a 6 wing. So are any of you regular meditators or want to share with us practices that you love or that you love sharing with your patients? Something that they have responded really well to? Or have your patients introduced you to something that you love? That's always fun when your patient brings something new to you and you go down the rabbit hole to explore it and you find something awesome. Lauren says yes, although her caregiving is starting to balance out and she's becoming more independent with a wing 4. I would agree. For myself, I think my wing is shifting. I have a lot less fear in my life, and fear doesn't live in the driver's seat anymore. Have any of you heard of the Enneagram? And do you know your type? Let us know in the comments. I will share there are tests for the Enneagram online, but really you have to type yourself. A test can help guide you, but once you read the descriptions of the different types and you can see yourself, if there's a type that really resonates with you, even if it's not what you test as, I would say that's more your type if you're resonating with it. There's lots of different books on the Enneagram. Danielle says she's not heard of it. Ian Morgan Cron has a great book called The Road Back to You. My personal favorite is the one from Richard Rohr. It, I, I think you can liken it to like a personality system, and it describes if you're of this personality and you're operating this way, it's less healthy, and gives you some ideas on where to steer things to be the most healthy version of you based on your ingrained characteristics. Lauren says Mirror is my favorite app, and I have a code 9SDUEB for a free month of premium if you want to be friends on there. Lauren, can you tell us more about the Mirror app? Is that related to Enneagram or something else? Oh, you're telling us now. It checks Enneagram, human design, astrology, disc, ocean, and more. All of the best personality tests in one place. Ooh, that sounds great. Oh, I have not used much astrology at all. Human design has been really helpful. And for those of you that haven't met our regional leader, Nicole Graham, she is a human design coach and expert, and she is fabulous if you're interested in looking into that rabbit hole and finding some insights for yourself. Are there any of the disconnections that we mentioned that you guys want to talk about a little bit, or that you have an example of that you want to share that was meaningful work, other people, meaningful values, childhood trauma, status and respect, the natural world, hopeful and secure future, and the role of genes and brain changes? I think all of those pharmacists can speak to, especially the work pieces. So if there's anything that any of you want to unpack and share with us. As I read through that list again, meaningful values came up for me, and it made me think of Brene Brown and her trainings, like the Daring Way. One of the things you do is to list out your values, and that's really helpful. I don't think we always sit down and write it out and make it so concrete. I found some of that work really helpful. Lauren says, I think a lot of pharmacists suffer from disconnection from meaningful work. The system of profit and time constraints have made many folks feel trapped in a job they no longer align with, which is why functional medicine has become so appealing. I agree 100%. I tell my life coach and career coach all the time that she's been better for therapy because all of the discourse I was feeling inside was work related. And it's because my values were not aligned with what I was able to achieve at work and what I was allowed to do. I want to put a shout out for Thea Blystone. She is a fabulous pharmacist trailblazer who is doing remote patient monitoring and chronic care management through collaborative practice with physicians. So she doesn't need provider status. All of the billing is done through the physician. And if you're interested in looking into that, Thea has a great program. So this discussion of having work where we're not getting to take care of patients in the way that we were trained and how that causes us moral injury, we can find ways to change it. And we've got to create the work ourselves. And so Thea is a great resource if you're looking into something like that. Lauren says, we spend up to a third of our days at work. It has to be meaningful or else it becomes detrimental to our health. And we did an amazing call with Thea that's in the boot camp too. Yes, so if you're in boot camp, if you weren't a current student when that call aired, go back and watch it because you've still got access. How would you guys change your work if there were no restrictions on money, time, location? What does your practice look like in a perfect world where you get to wave the magic wand? Does Thea have a link that you can post for us? Thank you, Lauren. She is on it. She sent a link to Thea's Substack. Thea has some great articles in there. I really enjoy reading the articles that she puts out. I'm curious if any of you have ever read The Heart Speaks by Dr. Vimy, I think it's Guarini, if I'm pronouncing her last name correctly. Lauren had a comment about Thea. It's not necessarily functional medicine, just to clarify. However, there's a lot of functional principles that can be woven in to those chronic care management sessions. She's got a lot of really good examples where that functional lens can be applied inside of that chronic care management and the way that that's structured and what you can bill for with the physician's NPI. The book, The Heart Speaks by Dr. Mimi Guarini, came to mind because I was looking through what are the solutions that were proposed in the book, and it's reconnection to other people and social prescribing. That's the one that made me think of her book because she prescribed one of her patients a dog. So she would have a companion and someone to help her take the walks that she needed to walk for her heart health. And it brought her joy. So I think we can get creative in what we prescribe to our patients I know we don't have prescriptive authority per se, but I think we have something better. We can prescribe these lifestyle interventions, or we can prescribe ways to connect. One of the things that I've done for my patients is I recorded some short chair yoga tutorials and I put them online, and I tell them start there. And once they feel more confident in trying a little bit of yoga, if they're hesitant to go to a class that they're unfamiliar with and they don't know anybody, I'm like, hey, try this at home in your living room, and then go out to the senior center and try the chair yoga classes there. So I have that resource available to help them bridge into a community class. Other reconnections are finding meaningful values, and acknowledging and overcoming childhood trauma, and restoring visions for the future. And you might look for someone named Terry Carlo on Insight Timer. She has some fabulous meditations and even some sound bath recordings that she's uploaded there. They're wonderful. Terry Carlo actually lives in my community.
You're on mute, Veronica.
Oh, thank you, Lauren. I appreciate that. I was looking through some of the questions I was going to ask, and the serotonin hypothesis of depression came up. And in the book, they discuss how that can sometimes be disempowering to patients if they hear that your brain is broken and there's nothing you can do about it. And how can we explain depression differently to patients that's more empowering? And how do we help them have the leg up? The question I wrote down is, how do you see the tension between the biological versus social explanations of depression playing out in our pharmacy practice?
So I can answer this in great depth because many of us in pharmacy school were probably taught heavily about the proposed mechanisms of the serotonin theory of depression. But if you read every single package insert of every single mental health drug that we have, they are all proposed. There has never been a definitive proof that a serotonin imbalance is the sole driver of depression. And so there was a large umbrella review, systemic umbrella review that came out 4 years ago now. Like, this is old news, old news that completely debunked and explained by looking at all of the studies done about serotonin and depression and how it does not tell the full story. And it goes back to exactly what we started the call off with, that depression is primarily a disorder of disconnection, of lifestyle, of the biopsychosocial model. So for any of us that are working as pharmacists, if we ourselves still believe in the commercials from Zoloft from the 90s of the little blob going across the screen that says depression is a serotonin imbalance or a chemical imbalance in the brain, and that is the full story of what we have to tell our patients, we are literally doing them harm, because it is not the truth. Depression is a multifactorial condition. Serotonin actually has surprisingly little to do with what is causing depression. And this is why we are seeing just as many patients now who have been on antidepressants for decades now, because it's 2026. And many of these people were started on them 10 or 20 years ago, never given the ability or explanation of how or why to discontinue them safely. And when they would attempt to go off of them, experience withdrawal symptoms that are mistaken or miscategorized as, oh, well, it's just your depression coming back. We just need to go back on the medication. When in fact, it is withdrawal symptoms. And so now the research is moving into, how do we safely get people off of these medications that have created chemical imbalances? We have artificially created the chemical imbalances by blocking serotonin's natural production. So, yes, now the question is, we see patients that are suffering from the exact opposite of what many of them expected, where we have created this numbing effect. So that's the root problem with only working with medications and using that as our only tool for treating depression, is that you're taking away the joy of life just as much as you're taking away the pain. And so when we work through the biopsychosocial spiritual model, and we actually start to understand that, sure, there can be a short-term temporary use for these medications to get through periods of time. But when we just use them forever, we're potentially creating more harm than good. And so now we're looking at ways to do hyperbolic tapering that can take a year or longer to get people off of these medications, and requires like a compounding pharmacist, because what we now do understand about serotonin is that when you're using SSRIs, the receptor sensitivity is actually the highest at the lowest doses. So there becomes a bit of a ceiling effect. And then the opposite becomes true as well, that as we take someone down from 100 to 50 to 25 to 12.5, we actually start noticing more of the side effects and the withdrawal effects at the lowest dosages, because that's when the receptors are actually starting to come back online. So, yeah, it is, to me, like, this is the actual definition of science, is understanding that a hypothesis that was formulated 30 or 40 or 50 or 60 or 70 years ago now, we're starting to disprove it. So we have studies and evidence and things that we believe for a certain period of time, and then we do more studies, and then we start to see that we didn't have the full picture before. So that's essentially what this article that I put in the chat that's published in Nature was trying to show, is that if we actually take all of the mountains of studies that we've done now and we look at it in conglomeration and all together, we can see where like this is actually not so great. This is why we see so many patients that are labeled as quote unquote treatment resistant, and they try multiple medications and nothing works. And this is where, again, we as pharmacists can come in and play such a huge role, right? Like we can help with things like pharmacogenomics to at least give our patients the best possible shot if they really are going to go down this pathway. But we can also start to look through the functional medicine lens and look at things like nutrient depletions, look at things like hormones, look at things like our gut-brain axis and how our microbiome affects our mental health. Like those are just the baseline systems that we need to evaluate before we label someone as depressed and hand them an SSRI. So I will step off my soapbox now.
We appreciate that, Lauren. All good nuggets for us to rethink if we haven't taken a step back to rethink what we're doing in practice. I think it's a really great reminder for all of us that there is a lot of new evidence out there and we need to be familiar with it if we're not already. Anne-Marie gave us a great app called Taper Clinic. She says there's a good app that discusses this called Taper Clinic and the difficulty in tapering most SSRIs. The information is out there, but the guidelines are not up to date. Most psychiatrists do not seem to be familiar with hyperbolic tapering. Thank you for that resource. I was not aware of that app, so I'm going to go check that out. Thank you. Well, we are at our time. I would like to thank each of you for joining us today and participating in the discussion. It's always wonderful to gather with you, see your beautiful faces, and find out who's joining us and hear great tips from each other on different resources, articles, and things that we can all use to elevate our practice and our knowledge base. Oh, Anne-Marie says it's not an app, it's a site on YouTube. Thank you for that clarification. We will all go check it out. Well, thank you all. Again, it's wonderful to spend the lunch hour with you, and we appreciate you taking time with us today. And we hope that we will see you next month. And the book that we're reading is called Viral Justice. So thank you all and have a wonderful day.